Okay, Miss Smith, my shift is almost over. I'll be back between 7 and 7:30 to introduce you to your new nurse. It's at that time that we'll be doing bedside shift report. It gives us an opportunity to introduce you to your new nurse as well as go over a plan of care. It's at this time that we would love for you to participate in your plan of care. Is that okay with you?
Yes, that'll be okay with me.
Do you need anything? That way you don't have to wait until after we're done with report. I can get you pain medication, take you to the bathroom, or anything else that you need help with.
No, I'm okay right now, thank you.
With bedside shift report, we like to keep the patient information confidential, so we ask that all visitors to step outside of the room. If you'd like for us to allow your company to stay during our report, let us know at that time. If you are asleep, would you like for us to wake you up so you can participate in report? The nurse and I will come in quietly to give report and do a safety check. If you're asleep, we'll try not to wake you up.
Great, I'll try to be awake for that.
Okay, give me a call if you need anything. Here's the call light to alert me. I'll be back in about an hour with the oncoming nurse to go over your plan of care with bedside shift report.
If there are 2 patients in the room, bedside shift report can still occur. We just are very careful not to discuss any kind of sensitive information or a diagnosis. In that case, we would just open up the electronic medical record and we would maybe point to certain information that we needed to get across to the other nurse without having to say it out loud.
When we do bedside report, we only deal with facts. We sometimes encounter a difficult situation with patients and physicians, but those frustrations should not be shared during the bedside report. Bedside report will help nurses only focus on the main points and avoid criticism and opinions to help nurse be more credible and professional.
Hello, Miss Smith. I'm here to do bedside shift report. This is Helen, your night shift nurse, and she's going to take great care of you.
I'm going to look at your armband. Tina Smith? Great. I'm going to go ahead and update your communication board.
And I'm going to pull up your chart on Epic. We're now ready to start bedside shift report to go over your plan of care. Can you please step outside for 5 minutes while we give Miss Smith her information about her care and do our bedside shift report?
No, it's okay, she can stay. She's my best friend.
Okay, great, Miss Smith. I'm going to give Helen report. At the end of report, if you have any additional comments or questions, please let us know. Miss Smith is a patient of Dr. Fisher, admitted yesterday with shortness of breath, fever, and cough. She has a history of hypertension, diabetes, and high cholesterol. During a colonoscopy 2 months ago, she was diagnosed with colon cancer. She had a colon resection with Dr. Bilchek 6 weeks ago, and she started chemotherapy with Dr. Fisher's office. She had finished her chemotherapy cycle 10 days ago. On today's labs, her white blood cell count dropped to 800, so we now have her on protective precautions. Dr. Winters is her infectious disease doctor, and I notified him about the elevated temperature. I gave her acetaminophen, and now her temperature is back to normal.
Did Dr. Winters say if he wanted me to call him during the night if her temperature spiked again, or when he wanted the next set of blood cultures?
I did ask him about that, and he did write an order right here to notify him if the temperature is greater than 102 or if she has shaking chills.
During bedside shift report, we include a head-to-toe assessment. We also look at IV tubings, we look at IV sites and central line sites. We assess the IV sites for infiltration. We also look at tubings, bags, and IV sites for dates, infusion bags for correct infusions hanging, PCAs being totaled, and also correct settings. We double-check high-risk infusions such as chemotherapy and heparin, and we also look at wounds and any drains together. Patient safety is our #1 goal. We want to make sure that what is being reported is accurate and that the patient surrounding is safe.
On today's labs, her white blood cell count dropped to 800. We now have her on protective precautions. Her portacath is on the left chest wall and was accessed yesterday when she came up to the unit.
May I take a look at your portacath? The dressing is intact, it's dated, and it looks great.
The IV is running at D5.5 at 100 cc's per hour. Oh, Dr. Fisher just wrote that order to add potassium. I'll hang a new bag before I leave.
Oh, no worries. I'll take care of that.
Thanks.
Our bedside shift report includes the SBAR format. This is situation, background, assessment, and recommendation. We also include as the outgoing nurse what has occurred in the last 12 hours, in addition to what brought the patient into the hospital and any pertinent information. We also include that time at the bedside to the patient as well as the oncoming nurse. Any test, lab results, why the test and procedures occurred, and any pertinent information for that shift that will better assist the oncoming nurse in providing her care. If there is a new diagnosis, such as cancer or an abnormal lab result, that information is not disclosed at that time at the bedside in fear of maybe the patient not being fully aware of that pertinent diagnosis. Therefore, that information is shared away from the bedside at that time. Our electronic record is EPIC, and we always use the professional exchange report as a guide for consistency. The WELL helps the oncoming nurse receive all the pertinent and accurate information he or she may need for her shift, in addition to starting her or his shift on time. It also allows us to review any possibility of missed medications or tasks.
Before bedside report, we used to give handout report at the nursing station, and only the oncoming nurse entered the patient room. The patient would have to assume that the plan of care for the day had been reviewed with outgoing nurse. Bedside report basically got rid of that assumption. By giving report in the patient's room, patient can witness the necessary information has been delivered to oncoming nurse, and they can see the transition from shift to shift with their own eyes. At the end of the report, we ask the patient if there's any questions or if our report was accurate. If they have some question and it's going to be a lengthy response, we politely ask them that we can come back and deal with it later. Since bedside report, I can see that patient has less anxiety and confusion, and they feel that they receive patient-centered care.
Did I miss anything, or is there anything else that you'd like to add?
I'd like to go for a walk tonight. It might help me sleep. I haven't slept a wink since I've been here.
That's a great goal. Let's go ahead and put that on the communication board, and I'd love to help you with that.
In the beginning, it did take longer to do bedside shift report, but now that we have been doing it consistently for 6 months, it's actually faster than report at the desk. The CNA changes the pitcher in the drinking water, ensures the room is tidy, and encourages the patient to use the bathroom or receive pain meds. The CNAs are expected to be out on the unit, answering call lights, assisting visitors, and answering their phone. They make a huge difference.
I think that completes our bedside shift report. Is there anything else that I can get for you today?
No, thank you.
Well, it was a pleasure being your nurse today.
Thank you so much. You've been an amazing nurse.
You're welcome.
Thank you very much.
You're welcome.
So I'll be back in an hour unless you need me sooner, and our nursing assistant will be in shortly to take your vitals. Okay, I'll see you in a little bit.
Thank you.